This is a short little video about what your pelvic floor is and how to do it, and we'll even do a set at the end for you to practice and tick off a set for the day. So your pelvic floor is a muscle. It's about the size and shape of your hands cupped together. So it runs from your pubic bone right at the front here through to your tailbone in the back and from either sit bones on either side there. So it really is the floor of your abdominal cavity. So its job is to hold everything in and close off around your passageways. So the simplest instruction, which you might have already heard, is to squeeze and lift as if stopping the flow of wee or stopping yourself from passing wind. So you should feel it around the front passageways and the back passageways. When we say don't squeeze your buttock muscles, we mean don't squeeze your bottom cheeks, but you should still feel that squeeze around the anus there. Other things that people often aren't aware of is that it should actually squeeze, lift and come forwards. So it's like you're drawing your back passageway up towards your pubic bone at the front, or that tailbone up towards your belly button. So they sometimes say like a plane taking off upwards and forwards. And that's really important so that you get that closure around your urethra at the front there. As you get that upwards and forwards movement, you also might feel your lower tummy muscles kick in and tighten. That's below the belly button though. When we say don't suck in or don't use your tummy muscles, we mean the upper tummy. So that should stay nice and relaxed. And that lower tummy, it's okay for that to tighten slightly as you squeeze and lift upwards and forwards. The other really important thing that you should be aware of is that it should let go again at the end. So much like doing a biceps curl, your muscles need to turn on and they need to turn off again. When you do a pelvic floor muscle contraction, it should turn on and then you should feel it turn off again. And that's a really important tip to knowing whether or not you're doing it correctly. Some people squeeze and lift their pelvic floor and then they think they're holding, except it's actually let go along the way there. And when they go to let go, they don't feel it let go. Other people squeeze and lift their pelvic floor, they're holding it there, and then when they go to let go, they actually don't know how to let go and it fades away, or they don't feel the drop. So if you don't feel the drop, then I'd highly recommend you go and see a pelvic floor physio to get that checked. That's sort of how to do it. So
maybe do some
different positions, yeah.
Do a few now in sitting and then in side lying. Yeah.
So to strengthen your pelvic floor, you want to be aiming to hold for around 3 to 10 seconds, and much like when you go to the gym, you want to try and do that a good 8 to 12 times. Often 10 is a good number to build up to. You can do this in any position. Lying down, particularly when you're pregnant, is easiest. Then sitting is often a little bit harder. Standing is harder again, and then even walking harder again. So we're going to try and do some lying down to begin with. So if you're lying on your side, you should be able to actually feel that little contraction with your tummy muscles. So we're going to try and aim to get, if we can, a good 3 out in each position. See how you go. So we're going to squeeze and lift that pelvic floor upwards and forwards as if stopping the flow of wee. And we're going to hold 2, 3, 4, 5, then letting it go. So 5 is a good number to start with, making sure that you feel that completely let go in between. You want to give it enough rest in between before you go again. So squeeze and lift upwards and forwards, tailbone to pubic bone and hold. 2, 3, make sure you keep breathing. 4, 5, then letting it go. And again, squeezing and lifting upwards and forwards. Keep breathing, feel that tummy tighten. 2, 3, squeezing. 4, squeezing. 5, then letting go. If you're feeling like that's that's getting easier, or that's feeling easy, have a go sitting. So now we're trying to lift everything up against gravity there. So in sitting, a little bit harder. Again, we squeeze and lift upwards and forwards and hold. 2, 3, squeezing, 4, squeezing, 5, then make sure you feel a let go. The belly will relax as you let go, giving it a good few seconds in between. Going again. Squeeze and lift back passageway to pubic bone and hold. 2, 3, squeezing, 4, squeezing, 5, then letting it go. One more here. Again, squeeze and lift upwards and forwards and breathe. 2, 3, squeezing, 4, squeezing, 5, and then let go. So we've done a good 6 contractions now. Can you still feel that let go? And can you still feel that muscle squeezing, or have some of your other muscles started to kick in? If you can't feel the let go, or some of your other muscles are starting to kick in, then maybe it's starting to fatigue, and you could even try going back to holding for just 3 seconds and giving yourself a little bit more rest in between those reps.